Through an innovative primary care grant, 3 community partners have had an opportunity to develop a summer fellowship in primary care for undergraduate nursing students, where they're able to learn and experience primary care nursing.
Hello, I'm Ann Lundy. I'm the Chief Operating Officer for Access Community Health Network. We're located in Chicago, and we have 35 fully integrated behavioral and medical health centers throughout Cook and DuPage counties. We primarily see Medicaid patients and also uninsured, but our hallmark is we're a patient-centered medical home. And what that means is that we really try to address the whole person. And in addition to all of this, we too are looking at the social determinants of health.
My name is Anna Brettschneider. I am a nurse, and I have the pleasure of serving veterans and employees at Hines VA Hospital in Hines, Illinois, as the Chief of Education Service and the Designated Learning Officer. To share in this learning experience with the students is also very beneficial because, as we know, veterans are everywhere in the communities.
When you were first starting, what were your thoughts about primary care? And over time, did your thinking about primary care change? And if so, how so?
I had always thought like primary care was just kind of like wellness checks and like very minimal care.
I wasn't very familiar with primary care, and it was even hard for me to really articulate its role within like the healthcare system as an entirety in the U.S. But throughout the summer, as we got more familiar and we learned more about it, I definitely realized how much of an impact it has on patients and how important it is just for general well-being.
And I kind of went into this fellowship hoping to like expand my knowledge on like primary health care and just going with a really open mind and just kind of absorb whatever I could during the experience. And I think when I left, I learned that it's a complex, dynamic specialty to go into within nursing.
I think it definitely needs more attention, local governments and organizations, because it is something that really improves people's health outcomes.
Our time at the VA kind of showed me was that there's so many more elements that go into caring for the whole patient. You're going to a dietitian, you're going to the nurse, and you have all these kind of connections.
Is there any particular experience that you had you found was particularly helpful to you in understanding the significance of primary care?
Specifically one time offering a patient an educational pamphlet on COVID, and he's like, "Oh, I can't read, so you don't need to give that to me." And I was like, "Oh, okay." But it just made me realize that primary care is an opportunity for healthcare providers to talk to their patients and figure out what those barriers are. And it just made me realize like this patient could be in a hospital or going through a procedure and not understand anything that was happening to him.
Screening visits with patients where we would just like ask basic questions like about their health and wellness. And the whole goal of that was really to like identify any potential problems they may have. I just think addressing the problem before it gets too far is something that I really see in primary care.
I guess one experience that stood out to me was my team had like a monthly meeting with one of our patients, and he'd come in and it was simply to go over all of his medications and get them in like the right pill boxes so that he could keep them organized. He confided in me that honestly, like without our help, it was all those medications at different times during the day it was all way too much for him to handle. And so he's really appreciative of that effort that we were making. And
So we've known how important the registered nurse role is, especially for the complex patient and their needs. We've seen a role evolve for care coordination, but even outside of that, even within the care team at the health center, we too see a need for the registered nurse as being a part of the team, especially with the critical thinking and the development that they have.
How do you feel that this experience impacted you from a personal perspective?
you know, we had a very unique experience in terms of starting this right at the beginning of this pandemic. The world still really didn't know a lot about this disease. And so honestly, that was a very scary time, you know, not only for like healthcare workers, but for, you know, especially like our patient population. And at the VA, you know, there's a lot of, it's mainly like elderly patients with a lot of like chronic diseases. And I think working through that just kind of strengthened my passion in healthcare, because the patients that we were able to see and were able to, you know, either do telehealth or see in person, we're so grateful to be able to see someone.
I'm a person who always in the hospital, like I like that setting because I like having like control over my environment. And I think that the primary care experience taught me, you know, that a lot of the time that control doesn't exist. Some weeks like patients would come in and they wouldn't want to wear masks, or there'd be huge families that would come in all at once and they didn't speak English and I wouldn't be able to speak to them. And so just, you know, adapting to all of those different circumstances really taught me to be resilient.
The pandemic really personally made me more compassionate and more empathetic to the people coming into the VA. You see them wheeling down the veterans so they could say hi to their family through a window, which is something you didn't see before. Or it really takes a toll on these people who have the veterans who have such a behavioral health aspect from the impacts on their earlier lives.
Just being present with just like people in general, but specifically patients.
Were there skills in primary care that you've been able to utilize in other settings?
Being able like to understand like patient values and priorities, because I think something that primary healthcare teaches you is that to really empower your patient to take control of their health and to be able to manage it. And I think that if you can't get like your patients on board with your care plan, then you can kind of just like throw that care plan out the window, because they're only going to do what they want to do and what they think is important to themselves.
And, you know, the readmission rate in the US is pretty terrible. So I think, you know, just focusing on not only the care in these acute settings in the hospital, but thinking about what happens when this patient goes home. Like, do they have everything they need? Do they need support? I think that's, you know, a really critical aspect of healthcare that gets overlooked.
I think a huge one for me was infection control. Just working in a COVID-19 testing site, I became very like cognizant of the environment that I was in. And I think that's definitely transferred over whenever I'm in the hospital.
We got to work with behavioral health a lot more than we do in class. And I think especially with the veteran population that we deal with a lot in the hospital, but we don't, or at least I didn't truly know what they went through.
Do you have any recommendation or wisdom that you would pass on to the next cohort of primary care summer fellows?
Take advantage of every opportunity they are given.
I would advise just to focus on your patients and your experience with them. Treat every patient as a priority.
To go in the mindset that the things that you learn throughout this experience are going to be applicable regardless of what specialty of nursing you go into. I think something that I also really took away from like this past summer was really focusing on like social health determinants, because those are going to impact accessibility, transportation, support systems, and those are all things that you're going to want to talk with your patients on, regardless of if like you're in like the pediatrics unit, med surg, primary health care.
So there have been many benefits on all sides. Win-win-win situation for the veterans who are here working with students, for the staff who now have this fresh perspective and also very informed evidence-based practice perspective of students who are the cream of their crop at Loyola, studying and bringing contemporary nursing knowledge and infusing that and integrating it into the teams here.
One of the aspects that we really value with our partnership with Loyola is really the caliber of the nursing student and the nursing fellow that they bring to Access. These are very well prepared academically, but their hearts and souls are prepared too. And that really speaks to our mission at Access, and really is probably one of the main reasons why this is working out so well. It's that combination of heart and brain, and they are well prepared and really wanting to come into an area of great need and service for very vulnerable populations.